Welcome back to KTN Weekend Express. This morning we're touching on matters health, sickle cell. Just remind you about our guest in studio. We have Dr. Frederick Okinyi and also Catherine Acheng, who's a sickle cell patient who's diagnosed with sickle cell at the age of 3. And also joining us is Etemesi OCHOLA, sickle cell. He was diagnosed with sickle cell at the age of 7, and for all that time he's been living with a sickle cell. And Etemesi, thank you for joining us also. Just talk to us about your journey, how it has been for the last 34 years.
My journey has been quite interesting and painful at the same time. For the time I was diagnosed with sickle cell, my schooling had been a challenge, but I thank God that I passed my primary school and the Form 4 level. I went to campus. So when I was starting my master's, that is when the crisis became more frequent, and I got something called a vascular necrosis, whereby I couldn't work for a year, and that is where even I got suspended from, discontinued from campus because I'd failed some units. So that is the journey so far. But I thank God that I've overcome it. Yes. And I've found a wife. I've got married and I have a son. Yes.
Okay. So for all those years that you've had a sickle cell, I mean, you look healthy, and you know we're discussing here about some people in the tool they have sickle cell, they look at it like a death sentence, and that is what Dr. said, that you should not look at it as a death sentence. For all those years, talk to us about your medication.
I've been managing the condition with three type of medication: hydroxyurea, folate, acid, and PENV, which is basically an antibiotic. Because I was told, even from research, from what I've done, is the hydroxyurea, which is a drug that was used to treat leukemia. So in sickle cell, it reduces the white cells. So I get infections so easily. If someone has a flu, I get infection. So I've been able to control that infection with the penicillin. That I take it every day. Yes.
All right. And you know, Catherine, OCHOLA comes in with an introduction of another drug. So you're taking 3 drugs.
Yes, 3.
But you're taking 2 drugs.
Yes.
Okay. So Daktari, taking antibiotics, and it means that not all patients who have sickle cell have to take 3 drugs, like including that antibiotics to be the 3rd drug, because Catherine only takes 2.
Now, let me begin by saying that sickle cell disease presents very differently in individuals. And the basic drug that most of them should get are normally the hydroxyurea and folic acid. And the next thing I must insist, always see a doctor and have the prescription from the doctor. Now, you are getting the PENV to cover antibiotics. Yes. Basically, you put most people on PENV, but some of them, we can vaccinate them against some of these infections so that they don't need to take the antibiotics throughout. So the presentation of the disease is varied in individuals, and you cannot just say that we are going to treat them the same way. If you are in a place where you have malaria, endemic infections, some of them get prophylaxis against the malaria. So I always insist the best thing, see a doctor and be seen regularly, so that if you have any small complication, it is addressed immediately, so that you don't have issues.
All right, and let me come back to you, Etemesi.
Yes.
When you say that it affected you also physically.
Yes.
How did it take a toll on you emotionally?
Yes, it did. Yes, it did. Because that year because I was doing masters in biology, and it takes a lot. It needs your concentration more. So emotionally, I was in pain all the time. In the class, I was in pain. I couldn't even walk. I was using crutches, and I was not even concentrating. I was out of class. I was admitted for a month, and the class is going on. During exam, I was in excruciating pain. So emotionally, I was very down. That year, 2011, was a very hard year for me. Yes.
All right.
Yeah.
Right. So, and Dr. also pointed out something very important in terms of your family lineage. So, within your family, is there anyone who has sickle cell?
In my nuclear family, we are only two. My sister does not have, only I. But in my extended family, I have two cousins. One passed on, and the other one we are age mates. And she's also not well right now. She's in hospital. Yes.
Right. And Dr. Let me rope you into this conversation before I bring in Catherine. You know, when a parent, when a woman is expecting a baby, before giving birth, there's several tests you're told to do, including a blood test. So when the woman is doing a blood test, is it also to identify whether there are cells, probably whether the parent has the gene of, is a sickle cell carrier?
The reason why most of them are not tested is because of availability of this test. Most hospitals don't have what we call hemoglobin electrophoresis. That is the definitive way of making diagnosis of sickle cell. But now we have point of care test. One of them is called Sickle Scan. It is available, and if you go to private hospitals, you can get it available. And it is not available in most government hospitals because of the procedure of procuring these things. It has to go through lots of processes. So in last year's theme for sickle cell was knowing status. And even the theme for this year, get diagnosed and make decision. So I will encourage people who come from regions where sickle cell is endemic. That is like coastal part of Kenya, Nyanza, western region. Anytime you are pregnant, it is good to ask yourself whether you have sickle cell. And basically anyone in those regions, whether you are pregnant or not, it is good to make to be screened early so that you make the diagnosis.
And just before you continue, Dr. You're talking about regions that are epidemic with sickle cell.
Yes.
So why would you categorize these regions? What makes it to be regions where sickle cell is very high?
Generally, the development of sickle cell disease was as a result of malaria infection. So malaria infection brought about a lot of pressure to the body. So generally in nature, the body tried to adapt to survive. So the sickle cell infections brought about mutations in the body that now led to the formation of that abnormal gene. So if you look at it traditionally, mostly it was common in the equatorial belt and also the Mediterranean region. And if you look at the history, there have been these different patterns of migrations. So when people are migrating, it's like the communities now that stay around most of the malaria-prone areas are the ones who have sickle cell. But because of migration patterns, we get patches of sickle cell disease almost in most.
So Catherine, Catherine and Temesi, do any of you come from one of the regions Dr. has mentioned?
Yes. I come from Ugenya.
You come from Ugenya, and
I'm coming from Bondo.
Yes.
And these are areas that
these are areas where we had malaria-prone zones. These are malaria-prone zones, and because of the migration patterns, you get that. Even if you look at Africa generally, you'll find it in West Africa. You get it in South Africa, and if you look at the migration patterns, these are diseases which are common basically among the Bantus, the Luos, and of course even in some parts of the coast, but because of the migration patterns. That's why now health is a devolved function, and we encourage the leaders in those counties to take responsibility and help their people. They should have diagnostic kits within the hospitals so that when a woman is pregnant, they get early screening, they know, so that at least you make responsible decisions. And one of the things that I find interesting, like maybe I'll ask you, when do you think it's important to know the diagnosis? Like now if you are to get a child, okay? Will you want to know that your child has got sickle cell at the time of birth or later on? What will be your take?
At the time of birth.
At the time of birth.
You'll want to know the diagnosis at the time of birth.
And
before I conceive.
Before you conceive.
Yes.
But then, Daktari, and it's good, Etemesi says at the time of birth, and Mercy says before she conceives. So at what point, Daktari, will she be able to know I'm a carrier? Let's just we're looking at it from a scenario of probably she's not a carrier, sickle cell carrier, same to Etemesi right here. So she talks about before conceiving. So at what point can she know I'm a carrier? And Etemesi says before before delivery.
Basically, this is something that we need to address as Kenyans. Sickle cell disease is a reality. It has been there right from the beginning. In the past, we didn't have methods of diagnosis. People were dying of sickle cell and they didn't know. But right now, with improvement of technology and healthcare, we can make diagnosis of sickle cell disease at any time. So if you come from any of those regions where I've mentioned, please, it is better you screen yourself and know. Why am I saying that? If you have someone with the sickle cell disease, it involves a lot of social and economic issues around it. So if you can make the prevention, if you can know early and prevent, why not? So I mean, this is varied. You know, you'll get different responses from different people. But what other healthcare professionals and even people who have sickle cell, I call them the sickle cell community, they are advocating for early screening. So you can get screened anytime you want to know about your condition.
Right.
And we encourage people to know their status.
All right. So, and you know, Mercy, Dr. brings in a very important point in terms of the social support. Yes. Of course, you've told us, you know, it's been very hectic on you, and I believe that's the same story with Etemesi when it comes to financial, you know, support, the amount of money used for treatment. But is there a need also for social support groups? And if there is need, are there any social support groups as we speak for sickle cell anemia patients?
Social support is very important. Like what Etemesi said, I also went through a time, I call it my depression time, when I was also diagnosed with AVN. I was just in first year and I had to stop schooling. So that is depression in a whole new, were it not for the support of my families and friends, I don't know if I would have pulled through. So we need to have a platform where we can just go and talk about it. Yeah, just talk what is your day like. There are ups and downs. Today you'll wake up with energy, tomorrow you'll wake up, you don't even have the energy.
So it's like your emotions are fluctuating.
Yes, chronic illness with mental illness, they go hand in hand. So we need to address both of them. Yes.
So when you say that you felt depressed, what really made you feel depressed? And yet at the same time, you know, you told us that this is something you got support from family, especially from your mothers and your teachers and your friends. And again, you're telling us you felt depressed.
Yes. This is my first year in university. I am so excited. First sem, I developed a pain on my right hip, and it became, the routine was a home hospital, because I could not go back to school. I was studying in Uganda, so I could not go back to school, always on painkillers. My friends have moved on. They are continuing with their education. You are in a state where your daily activity is home, hospital. That is very depressive. Because you see your peer, they are getting ahead with life. You seem to feel stuck at a particular point. Regardless of the support that you get, personally, you'll get some level of depression. Yes. Okay,
so Dr. then it means, you know, sickle cell also affects an individual's physical being, because Etemesi talked about, you know, being affected physically. He had to use crutches for how many years?
For 1 year.
For 1 year. And then Catherine also talks about having hip operation.
Basically, when you talk about health, it means physical and mental well-being. And what they get most, what the two have talked about is called a vascular necrosis of the head of femur. So, you know, when these blood cells, you know, the normal blood cells are supposed to be round and flexible. But when you have sickle cell crisis, they turn the shape of a banana. So they easily stick and block the blood vessels. So eventually the hip does not get enough blood supply. And then we say that the head, that part dies. So eventually need replacement. So this disease basically, from the point of view, it is inherited. These abnormal genes are present in your blood, and you can transmit them to the generation.
All right.
And one issue that has not come out very clearly that I need to explain.
Just before you just hold on to that thought, Daktari. You'll explain it to us just in like a few minutes, because I need to get the view, the sentiments of one of our viewers, Bernard, who's now calling us from Ngong. Bernard, good morning, and thank you for talking to us here on KTN Weekend Express. Your question or your thoughts this morning about our topic? Bernard, if you can hear me, your thoughts or your question for Weekend Express topic?
Okay, I'm Bernard.
Yes, continue, I can hear you.
Yeah, I want to ask that if there is similarities between multiple myeloma and sickle cell disorder. Are there similarities between multiple myeloma and sickle cell disorder?
All right. Bernard, I think, for clearance of understanding of your question, kindly break it down for us so that, Dr. Okinyi can be able to respond very clearly.
Okay, my question is, are there similarities between multiple myeloma and sickle cell disorder? Are there similarities?
All right.
Yeah.
All right. Thank you so much, Bernard, talking to us from Ngong. You've heard his question.
Sure.
Yes. Are there similarities?
Those are completely different diseases. Sickle cell disease affects part of the blood called the red blood cells, which carries oxygen in our body. Multiple myeloma affect white blood cells. They are what we call abnormal plasma cells in the body. So those are very, very different. And sickle cell disease basically is inherited from one generation, from parent to the offspring. But multiple myeloma just develops as a result of abnormalities in the genes that happen along the course of life.
So can an individual have both at the same time?
Not necessarily. Not all the time. It doesn't mean that when you have sickle cell disease, you are going to get multiple myeloma. No. Sickle cell disease is inherited, but anyone can get multiple myeloma. That's the difference.
All right.
But you can have sickle cell disease, then develop multiple myeloma.
All right. And Etemesi, as I'm talking to you right now, you've told me that, you're married.
Yes.
and you have your wife. So how has it been, getting married? You have sickle cell. How has it been also for your spouse?
It has not. I remember the first year of our marriage. It was a bit challenging when she now was getting in touch of, was getting face to face with the crisis. Me getting painful crisis in the middle of the night, and her calling for people to take me to hospital. But now she has gotten. She has known how to manage it. And she has known she has controlled even my diet. Because at one point I was a bachelor, so I was not eating properly, so even my health was deteriorating. But now when I'm married, she knows what I'm limited to do statutory things, maybe to go out with boys. Yeah. And she has known how to, if this cold weather, she has known how to manage me very well. Yeah. She has grown in it. She has read it.
So there's awareness. She's been aware about it. And Catherine, when you talk about diet and and this cold weather, it becomes a question in terms of then what sort of diet do you have? Do you eat normal food, or when you cook, are there restrictions of what you need to put and what you need not to put?
No, personally for me there are no restrictions, but depending on the weather, like now I can't take cold drinks because they'll cause crisis for me. So I prefer hot drinks.
All right. So food, you eat any?
Yes,
okay.
I do.
But Etemesi, what food don't you eat, or is it like the amount of salt, oil?
I don't eat bananas. I don't know what the reason behind it, but every time I used to eat banana, I used to get the crisis. I don't know why. I still can't explain it. Yes, so I don't eat bananas, but any other food that I eat. Yes, I remember also when I was living in Mombasa, in one of the sickle cell forums, we were told to reduce on chilies. Because it makes, I don't know if this is true, Daktari, it makes the blood lighter.
Daktari will actually expound on it.
Yes, I don't know the reason, basically scientific reason, but so that, because sometimes they say that pilipili does, what it does to you, it just reduces your oxygen level in the blood.
Okay.
Yes.
So Daktari explained to us about bananas and chili, because Catherine says she can eat anything. Do you take chili?
Yes.
You eat bananas?
Yes.
But when it comes, the only thing that affects you is the cold weather, like right now.
Yeah.
But for Etemesi, it's the cold weather and the food.
Basically, whenever I interact in such forums, I also learn a lot. And the one for bananas, I have no explanation. I mean, I don't know. Because you see, as I eat bananas and gets no problem.
Yes.
Right? But I think I'll go to the basics to answer you. First of all, maintain good, healthy diet. That is the first principle. The other issue about chilies, that one I don't know. I don't know. I'll tell you what I know. But then we've also had people even talking about nutritional supplements that add value. The truth is, there could be some element on how it works, which maybe we don't know. But generally, having a healthy diet is the first. Then when you talk about keeping warm, that is very, very healthy. Then you also talked about, lifestyle, basically. You know, we won't encourage someone with sickle cell to smoke, take a lot of alcohol, or engage in risky social behavior. Basically, those things will precipitate crisis. So generally, about diet, I'll just maintain eat healthy diet, just like any other person. There are people also who don't take bananas for different reasons. Some don't take pili-pili, but we cannot relate everything to
sickle cell.
Exactly.
All right.
Yes.
And let's talk about our blood transfusion, and that's a sector I'd really like Dr. Kinney to actually expound on it. But just before you get your sentiments, Catherine, are you eligible for blood transfusion as we speak? And probably, if you are, how many times have you given blood?
And I don't give blood because I'm anemic. I don't even have enough to give.
You don't even have enough to give?
Yes.
I don't even give blood. My HB ranges from 9 to 11. Right now it's 11. And the normal male is 14. It's 14. So yes, so I'm not eligible to give out blood.
All right. And so, Dr. just before even we hear from, I have 3 callers online. Just before they give us their sentiments or their question, we have Zuleka Hamid from Kibra, and also later on we shall be speaking to another caller. And the other caller is Peter Njoroge and Eunice Owino. So let's talk to Zuleha Mohammed from Kibra, just before we get your sentiments on matters of blood transfusion. Zuleha, good morning. And your question or your sentiment this morning? Zuleha, if you can hear me?
All
right, it looks like we've lost her, but probably we will try and get her. Zuleha, good morning. If you can hear me, this morning you're talking about matters sickle cell, matters health. Your question or your sentiment?
Hello?
All right, we're still trying to get a hold of Zuleha. Let's go now to Eunice, another caller online. Eunice Owino from South B. Thank you so much for talking to us here on KTN Weekend Express. Your question or your sentiment?
Number one, I'd like to thank Dr. Okinyi, Catherine, and Temesi. The 2 of them are
Eunice,
warriors.
good morning.
Morning to you.
All right, we're trying to get a hold of our callers, matters technology this morning. We can't really explain. But, Dr. the reason as to why I'd asked Catherine and Temesi matters blood transfusion, because it is something that, during times of crisis, probably people with sickle cell anemia might want to, donate blood. Are they eligible? Are others eligible? Others not eligible? Because, she says she's already anemic, so she can't donate blood.
We have what we call national guidelines for blood transfusion, and the conditions and the type of people who are supposed to donate blood is quite well spelled out. So basically, having any other disease, one of them sickle cell, you cannot donate blood. Basically, most people who have got sickle cell, the hemoglobin level is always low, mostly below 9 or 10. And, so they are not eligible to donate blood. Basically, they're going.
So if it's below 9 and 10, so how many times, should, Catherine and Temesi go for blood transfusion?
So before they are transfused, they are what we call indications. So not everyone with sickle cell should get blood transfusion. Most of them you'll find they are normal, but you only transfuse them when they develop symptoms, like maybe of anemia or when they have crises. That is when it may be necessary to transfuse. So there are specific indications for transfusion when someone has got sickle cell. Like now you see both of them are normal. They don't need transfusion. What is most really interesting, you find some with even hemoglobin as low as 6, and they're okay. They're just walking, playing, active. So you only transfuse when there's a proper indication for doing that.
So, Catherine, your hemoglobin has dropped to what level that necessitated a blood transfusion?
The last transfusion I had is because I was going for surgery. So that one, the doctor wanted to boost it to at 12. So I had I was transfused 3 pints.
3.
Yes, to get it to 12.
Okay.
The other time I had a very bad crisis that medication wasn't working, so my doctor recommended a transfusion.
All right.
Yes.
Just before I get your sentiments at Messi, let's talk to Hamid from Kibera once again. I think you've gotten a hold of him. Hamid, good morning. Mohammed, good morning. And your question or your sentiment, Hamid?
Hello? Hello? Okay.
Hamid, kindly, if you can hear me, kindly let us know about your sentiments.
Habari ya asubuhi, ma'am. Habari yako?
All right, technical issues right there beyond our control, but we'll continue trying to get a hold of our callers online. And you know, the same question that I'd posed on Catherine when it comes to blood transfusion, but I'll twist it a bit. When you get your blood transfusion, members of your family, probably because Dr. says sickle cell is more like inherited, can they, like, you know, give you blood transfusion, or you have to get it from someone else?
They can if they are on the same type. They don't actually have a problem. Like my mom is a blood donor. She has a gene, but does not have the symptoms of a sickler, and she's very healthy, so she can give us blood. Yes, so I can get blood from my family, except those people who are sicklers like me. Yes.
And you know, Temesi brings in a very important conversation, Dr. over here. He can get blood from anyone, but not anyone who's a sickler. So does it mean that even if your parent has the, you know, shows some sort of signs that they're carriers of sickle cell, they can still donate?
Someone with sickle cell disease basically has the 2 abnormal genes in their blood, and that's why the cells are abnormal. Someone who is a carrier, a certain percentage of the cells are normal, and some have got are abnormal. So it has worked. So that is a situation. And then again, when you are donating blood, we don't screen you whether you have sickle cell. But someone who basically has sickle cell disease will be symptomatic and will never even donate blood. So we've had situations where carriers donate blood, it is transfused, and it works.
So what happens, you know, and this is a question that I'm sure probably one of our callers might have wanted to ask. You know, you've had your child at the age of, let's talk about the same age like Catherine was saying, at the age of 3 being diagnosed with sickle cell. But at the age of 32, has wounds, you know, on the leg, and anytime they do treatment, it keeps on going and coming back, like there's no permanent solution. Is it the same situation that it's sort of like, because of lack of blood, the wounds can't go away very easily? That's just from a layman.
Okay, so what you are basically talking about is a complication of sickle cell called ulcers. The ulcers mostly occur on the legs. And the reason for that is that when you have sickle cell disease, your hemoglobin level is always low. It's always less than 10. And for a wound to heal, there has to be proper blood circulation around that area. So if you have developed one of those complications called the ulcers, they're basically very, very difficult to treat. They don't heal very, very well. But if someone is on proper medication, you diagnose them early and you take care of the wound, they heal. Yes.
All right. So as we wrap up this conversation, Catherine, have you ever had any wound and it's healed?
No, I've never developed like that.
You've never developed like that? And
Yes, I have wound. I have at the same time I was not working. I developed a wound. That's why I didn't go for surgery, because they wanted to treat the wound first before I go under the knife. Yes.
All right. Ladies and gentlemen, thank you for talking to us this morning on Weekend Express. In a minute, each of you, your message of encouragement to a parent who has a child who has sickle cell or someone who's a sickler. I'll start with you, Timothy.
Okay. Sickle cell is not a death sentence. It is yes, it's a condition that when managed properly, you can live longer, because you know your condition, you know the signs when there's an attack which is coming, and as the Tari say, the proper diet. If you eat proper diet, if you keep yourself warm, and if you take medication, then you'll be good to go. Yes, and live just positively.
All right, Catherine.
Yeah, I like to say positivity and understand your condition. Because as Daktari said, it manifests different. So don't blanket it that I have sickle cell, this is the path that I'm going to take. No, understand yourself, know your limits, and keep away from negativities. Yes, you
need the positive energy.
Exactly.
Negative energy out.
Avoid negativity. Yes, surround yourself with positivity. Yes, and the strength in asking for help. Yeah, if you need help, please ask.
Just in a second, before I rope in Daktari for a minute, because we need to wind up. The support health group you're talking about, how many times do you meet?
It's virtual.
It's virtual?
Yeah, it's virtual.
All right.
Yeah, we are yet to establish a physical.
A physical one?
Yes,
all
yeah.
right. And that's very important.
But they are the ones that exist. Like the Children's Sickle Cell Foundation, they meet regularly. They also have a clinic that you can go and be tested every week. Yes, and now there's the virtual one, whereby people meet through WhatsApp, the online platform.
Online platform.
Yes, but we are all in one group. Like, that's where we met.
Yeah, thanks to technology.
Yes.
Daktari, in a minute.
My word is, if you have sickle cell, follow the instructions of your doctor, attend to health regularly, and health is a devolved function. You'll be getting health care from your counties and nearby hospitals. So we also encourage county governors, please provide resources, and the National Health Insurance should actually finance the care of people with sicklers, from diagnosis and even treatment. Yes.
All right. Thank you so much, ladies and gentlemen. Talking to us about sickle cell disorder, Catherine Acheng, a sickle cell patient diagnosed at the age of 3, and Etemesi Ochola, sickler diagnosed at the age of 7 years, is now 34, and Dr. Frederick Okinyi talking to us about sickle cell disorder. Bringing me to the end of Weekend